Good evening, Black people and all allies fighting for Black liberation, Black prosperity, and Black joy. I'm Charles Blow, and welcome to Prime. The World Health Organization warned yesterday that a new, highly mutated coronavirus variant poses a very high global risk because of its potential impact on vaccines and its transmissibility. Earlier this month, South African scientists detected the new Omicron variant and reported it to the World Health Organization last week. Fewer than 100 cases have been confirmed, but the variant is popping up in more than a dozen countries across Europe, Asia, and Africa. Swiftly, the U.S., Canada, Britain, and the European Union moved to restrict travel from South Africa and 7 other African countries. Earlier, I had a chance to talk with Lois Pace, Assistant Secretary of Global Affairs for the Department of Health and Human Services, to discuss the administration's decision. Take a listen. Ms. Pace, thank you so much for joining us tonight. The Omicron variant is now on the horizon. We don't know yet all the specifics we need to know about how effective or how virulent it is and whether or not it dodges our vaccines or not. And yet, countries across the world are instituting travel bans for Southern African countries, including the United States, even though the WHO urged countries not to do this, saying travel restrictions may play a role in slightly reducing the spread of COVID-19, but place a heavy burden on lives and livelihoods. Some recent studies have even shown that travel bans were ineffective, but the economic and other consequences, we are still seeing those today. Why did the United States join other countries in imposing a travel ban on these Southern African countries?
Well, it's important to keep in mind that any public health measure needs to be combined with other mitigation strategies. And so it's not travel restrictions alone we're doing, which is really meant to buy us some time to, as you said, understand what this particular variant is really doing, how effective our tools remain in the wake of this variant. But we're also really focused on ramping up testing, understanding where we are with vaccinations and ensuring that people are lining up for those shots in arms, and doing other things to ensure this type of consideration, this type of restriction is worth it in the end.
You say that, it is about buying time. I just want to dig into that just a little bit. The president today basically said that the arrival of this variant in the United States, if it is not already here, is basically inevitable. What do we buy with that time, and what is the trade-off? Because the other scientists, the World Health Organization is a scientific organization. The scientists are saying this is not what you should be doing.
No, it's a really important question. And so one of the things we want to be sure we do is ensure that we are not sort of overwhelmed by any new iteration of this virus. We've seen what could happen with Delta and other variants before then. I think the good news is we know how to find it if it is here, and we sample 80,000 samples every week, thereabouts, and that's more than any other country in the world. And so we really do have the system in place to seek it out and understand what we're dealing with. Of course, we're seeing other countries recognize this problem within their borders as well. But that's the best that we can do to really ensure that we are, again, using this strategy to the best use, and of course, not forgetting all of the other things that are essential, like vaccinations, like testing on a regular basis, and like otherwise ensuring that people understand what they can continue to do to protect themselves. That's the bottom line too, knowing that what we have in place works, and knowing that we're in an even better position than we have been previously to even be able to stand up to this particular variant. We've had so many variants before we got to Omicron, right? To know how effective we have been. And so I want to be hopeful that we can make it through whatever this one entails as well.
In January of 2020, President Biden wrote an opinion piece in USA Today condemning Donald Trump for advocating for what he called reactionary travel bans in African countries over Ebola in 2014. A couple of days later, he said that Trump had a record of historical xenophobia. How do you push back against claims of hypocrisy on the Biden administration's part here? Because there are other countries where there now are cases of Omicron. There's even community spread in some countries outside of the countries in Southern Africa that now have travel bans. How do you push back on people saying that there's a double standard being applied here?
Yeah, I think it's making sure that we're doing more than just instituting travel restrictions. I think another important part of this is ensuring we're working in lockstep with the government of South Africa. So we had a call with the health minister that he spoke about in his readout in his country, as we did as well. And we assured them that we stand with them. We applaud them for lifting this up for the world to understand. And that's critically important because actually the initial cluster of cases were found in the Southern African region. And so again, I want to applaud the work of scientists in Botswana, South Africa, and elsewhere who really ensured that we understood that this could be a problem. But we know that the science evolves too, right? And so even though this initial cluster has been there and we recognize that some of the initial cases outside of the Southern African region were tied to travel, we know that we'll continue to learn more in the coming days and weeks, and we'll be able to revisit our policies and strategies as a result. But that's, again, thanks to and credit to our colleagues in the region and on the continent.
In September, Biden committed to shipping 500 million doses to the world's 92 poorest countries by December as part of the World Health Organization's COVAX mission. But as of last Thursday, only 25% of those doses have been shipped as promised. Why is that?
Well, we're very proud to have shipped close to 300 million doses at this point. I think we're about at 275 million in over 100 countries, and so that's outpacing any other country in the world. We're hoping that these other countries can step it up as well because we will still need supply. That's kind of how we got here. We could have predicted this variant emerging in a place where vaccination rates are still somewhat low, and credit to South Africa for vaccinating as much of its population as it has, and yet I know that they have joined the cries to sort of close this disparities gap when it comes to vaccines. But we're on pace to continue sharing the 1.2 billion that we committed by fall of next year, and so that work continues. We're getting tens of millions out the door by the week, and that's really been an effective model, especially working through regional bodies like the African Union, like the Caribbean community, and certainly ensuring that we're working at a global level to get these vaccines to everywhere they're needed around the world.
Do you believe that rich countries like the U.S., I know you just said that you're proud of the how many doses that the U.S. has shipped, but are rich countries really doing enough to help countries in Africa? The continent of Africa is 1.2 billion people. The vaccination rate of the continent is about 6%. That is, a tenth of the U.S. vaccination rate, which is about 60%. Is there something more that the U.S. and other wealthy countries can be doing? Because if we don't do it, right? If 94% of the African population remains unvaccinated, it's just a kind of breeding ground for variants to grow.
That's right, Charles. We absolutely need to do even more than we're doing today. That's why the U.S. has been investing in manufacturing of vaccines. In fact, we made an investment in South Africa specifically to ensure they could produce up to 500 million doses of vaccines that could supply the continent. We also did something that not a lot of countries have done, but we gave up our place in line when it came to purchase orders. And so, something else to keep in mind is that you have the governments of Africa saying, we are ready to receive what you have available as surplus, but we are also ready to purchase vaccines. And so we said, okay, let's work with Moderna and ensure they're working with the African Union so that they can make these purchases that they don't have access to currently. And so we think other countries should be taking those types of steps. We've also made some pretty strong statements around intellectual property waivers and just done some other things to do more than sharing, as you said. So we think that's absolutely appropriate, and we just hope that other countries that are able to do so follow suit.
Ms. Pace, I want to just thank you so much for your time this evening. I know it's a busy day for everyone on the COVID task force, so thank you for making time for us. I really appreciate it. We just heard from the Assistant Secretary of Global Affairs for the Department of Health and Human Services on the Biden administration's decision to impose a travel ban on 8 African countries. Joining me now for their reactions, Dr. Ala Stanford, founder and CEO of the Black Doctors COVID-19 Consortium, and Dr. Corey Hébert, Chief BNC Medical Correspondent. Dr. Stanford, I want to start with you. Do you agree with the U.S. and other countries imposing a travel ban on these 8 Southern African countries?
First, thanks for having me on this evening. Right now, I do. This Omicron variant is the most mutated of concern variant that we have seen. We had Alpha, Delta, and there's been a myriad of others that you don't even hear about that you have to study over a couple weeks. You have to take vaccinated blood plus vaccine and see how it impacts the antibody response. And those studies need to be done. Right now in Australia, Hong Kong, and South Africa, this is primarily being seen in young, healthy otherwise, and often vaccinated individuals. We don't know what happens when Omicron gets to our elderly, our vulnerable, those with chronic conditions that can't mount a good response. And before we allow it to spread even further, I think this is just one mitigation strategy. And I should mention, for other countries to come into the United States, there is scrutiny. You do have to be vaccinated and or have a negative PCR test to enter into the US. So it's not just South Africa. So do I agree right now? Yes. Over the next 3 weeks, we'll know more about transmissibility, about infectivity, about the severity of disease, and this will give us some time to figure that out.
Dr. Hébert, I want you to weigh in on that because the WHO has said they do not agree with this, that this is not the right thing to do, that it has a minimal impact on the spread of COVID, but it has a tremendous impact on economics and people's livelihood. There have been some studies that says there's almost no impact whatsoever on the transmission of the disease, but these bans do have a long-reaching effect on economics and other kind of social conditions. I mean, I guess the question just remains, as Dr. Stanford was just pointing out, we already require people to be vaccinated before they come into the United States. So why these 8 countries when we know that there's even community transmission in other countries that are not these 8?
Yeah. Well, Charles, this is what I can't stand about this. The optics of this just looks ridiculous. First of all the doctors that will be on this program throughout the entire day and through all the networks, we know that the Omicron variant is here in the United States. Let's be honest. The reason why, we talk about the Spanish flu is because Spain decided to say that Spanish flu was there. They didn't invent it, and weren't the first country to have it. So just like South Africa wasn't the first country to get this variant. South Africa has a very sophisticated surveillance system, and they were the first country to say that they actually had it and could type it. So we have this horrible optics of we have these southern African countries that are banned, and we have all these other countries, including Belgium and Italy and all these other places that have it, and they don't have a travel ban. It's just optically, it just looks horrible as far as I'm concerned. And we also know that when we opened our borders to everyone basically to come in for Christmas and Thanksgiving, that was a pure economic situation that we did that. And now they all came to the Macy's Thanksgiving Day Parade. They all had fun. They all didn't wear masks. They all went around and went back to their countries and spread it all across the United States. So we will know in about a couple of weeks. And the doctor said it best. It takes a few weeks for us to know exactly what this is going to do. But let's make no mistake. We know that this virus and this mutation, I mean, I've done clinical trials on all of these vaccines and all the monoclonal antibodies, and we know that it is going to have a significant impact on our vaccines because we know that the spike proteins on the variant are the ones that are mutating, and our vaccines are directly hitting this spike protein. So it's going to be an issue one way or the other. So we can act like, we just put our heads in the sand and say, oh, we'll just wait. But we don't need to wait. We know already. We've done this for 22 months. We know. And so the optics of that are just look horrible and it looks racist.
Dr. Stanford, do you worry at all that putting this travel ban on South Africa and those other Southern African nations creates a disincentive for other countries to try to find new variants and to share the fact that they have found them, if in fact the response from the world may well be that your country becomes the one that is on a travel ban list?
So I don't. And the reason I say that, the UK announced in the past 48 hours that they are encouraging boosters. And now, instead of you having to wait 6 months, they want people to get boosters at 3 months now. They're making it available to everyone. They're prioritizing the elderly first and those most vulnerable. So they're not saying, oh, this is just a South African disease and it's these southern countries in South Africa we have to be most concerned about. They recognize that this is in the UK, that it will spread like Delta spread, and we want to protect our residents in the UK as best we can. We know right now that boosting your immune system will help to do that. And optics as they may be, I agree with you, don't look great, but the facts are the majority of the cases, at least that have been reported, and we can say maybe South Africa was honest about it and other people are not, but the majority of the cases right now are from that region. And so for us to really look at the genetic strain and sequencing of this Omicron variant is prudent for everyone to learn and see how we can protect. But as the doctor said, of course, get vaccinated. If you're eligible, get the booster. If it's been 6 months after an mRNA, 2 months after the adenovirus J&J, still wear your mask indoor, still socially distance. Ventilate when you can, meaning open a window, and know who you're around. And I would suggest vaccinated crowds of people, and encourage the people you love who are still on the fence to roll up their sleeve and get vaccinated. This is not a hoax. It's not going away. We're in the next stage, and we need to do what we can to protect ourselves, protect our families. And I'm still dealing with people who are dying from COVID, still dying from COVID. When one member in the family gets vaccinated and the others don't, and some of them don't make it. So anything we can do to mitigate the spread, I am in support of. Not solely travel ban, there are many other strategies, but if that is one to allow us some time, 3 weeks in the grand livelihood and lifespan of this condition is not a long time for us to understand what we're dealing with.
Dr. Hébert, as we've mentioned here on the show before, there is a partisan divide in who wants to be vaccinated, who is getting vaccinated, but there's also a racial divide. There are not as many, as a rate, Black people getting vaccinated as some other racial groups. What impact do you think this variant will have on Black people? I know we don't know all the answers yet. We don't know how transmissible it is. We don't know if it evades the vaccines. But we start from a deficit. So what is the effect you think?
Yeah, so basically what we're looking at here is we look at other countries and we know that there's vaccine apartheid. We know that there's an issue with this being a pandemic, and we in the United States have 3 shots available to us, and then other parts of the world have never even gotten one. That's why we have these issues right now. But the bigger issue is that we know also that from the reported cases that this is a very mild disease so far. We know it's very transmissible, but we think that it may be much milder than the Delta variant. So we in America, Black people, have a vaccination rate that's just as bad as some of the countries that are listed in the travel ban. So we can no longer divorce ourselves from them because we're the exact same way. Because we have the historic distrust. We're the ones that are not getting vaccinated. We're the ones that are out there fighting the good fight to get other Black people vaccinated. But we can run, but we can't hide from that. So what we must do now is to encourage all of the folks that'll be sitting around these Christmas dinner tables and Thanksgiving dinner tables to make sure that they discussed it at Thanksgiving, make sure they discuss it at Christmas, and these people need to get vaccinated because no matter what, the vaccines that we have made, the vaccines that we give out are for coronavirus. So just like with the flu vaccine, some years it's good, some years it's bad, but every year the flu vaccine is different. So for people saying, oh, if it was so good, we wouldn't have to change it, we wouldn't have to get so many boosters. That's just ridiculous. In pediatrics, you get a booster shot 2 months, 4 months, 6 months, 12 months, 15 months, 4 years, and 12 years and 16 years. So that's the way it is. That's the way flu is, and that's the way this is going to be. So you have a vaccine, you will have some protection against coronavirus. I don't care what the variant is. And that's what we have to kind of come to grips with now as Black folks.
Dr. Ala Stanford and Dr. Corey Hébert, I am exhausted by this disease, but I am getting my booster this week because Lord help me.
Wash your mask up,
thank you both so much.
Charles.
There you go. Thank you so much for your time.